Welcome everybody to today's Dementia Practice webinar. My name's Gary O'Toole. I'm the National Consultancy Lead at the Centre for Dementia Learning at Dementia Australia. The topic for today's webinar is Transforming Dementia Support, Navigating the National Education and Training Framework. We've got a fantastic panel of experts joining us today to shed light on the intersection between the aged care accreditation standards and the new dementia training framework. I'd like to begin just by acknowledging the traditional owners of the lands on which we all meet today. I would like to pay my respects to elders past and present and to our shared futures together. I'll just introduce our webinar guest today, Megan Cox. Megan is a registered nurse with extensive experience in the aged care sector. She's currently the Director of the Restrictive Practices Unit, Aged Care Quality and Standards Commission. Thanks for coming along. Also introduce Dr. David Sykes. David is a highly respected figure in the field of dementia care and education in Australia. He serves as the Director for the Centre of Dementia Learning here at Dementia Australia and is also a Director of Dementia Training Australia. Thanks, David, for coming along as well. And Jackie Newman. Jackie is a registered nurse and currently working as a facility manager at St Vincent's Care in Hawthorn. She's previously worked as Hawthorn's behaviour support nurse and has a huge amount of experience. So we're really looking to hear from you as well, Jackie. And finally, we have Mandy Ha. Mandy's a physiotherapist by background, but has been working as a learning designer at Dementia Australia for a number of years, almost as long as I've been here, I think. Could I just a little bit of, we call it, a little bit of information. You will see that there is a opportunity for you to ask questions in the Q&A box. If you like a particular question and really would like it to be responded to, if you can click the upvote button, and that will raise it up the schema for us, and we'll be able to try and get your questions to our panelists. I'd like to begin our discussion just by asking David if he could tell us a little bit about the development of the new National Dementia Education and Training Standards, where they came from, how they were developed, and what do they look like?
Wow, in 20 words or less.
You've
thanks,
got
Gary.
about 3 minutes, David.
Okay, your time starts now. Welcome, everyone. Thanks for joining us today. Really thrilled to be able to talk to you about the National Dementia Education and Training Standards Framework that DTA have developed, and proud to have our association with them. Probably just because I'm not going to have time to cover a lot of the detail of it, but there's certainly more information on the DTA website, dta.com.au, and if you just search the National Dementia Standards even, I think it will come up. So there's some resources there that you can look at. There's also the standards themselves. So a bit of the backstory to this, that certainly it's been an area, I think, dementia education, that for a while we certainly have, and certainly other consortium members of DTA have been concerned about the fact that there isn't a national standard around what should be covered in dementia training across the country. Probably the notable exception to that is the unit of competency relating to dementia from the Cert 3 in individual support, which we deliver as the Dementia Essentials program as part of Dementia Training Australia. Outside of that, there's really no nationally set standard around dementia. And so with the support of the department, DTA were funded over a number of years to develop this framework, informed by some reviews of overseas frameworks, particularly in the United Kingdom, where they've had similar frameworks for a while. And I think for us, it was about really setting a bar and a clear direction for training, whether that's training providers in terms of guidance about how they structure their curriculum, whether that's care providers in terms of helping to inform what they look for and what they need to consider in terms of the training of their staff, or indeed individual staff themselves in terms of where they think their strengths are and where they might see the opportunity to improve and enhance their skills in dementia education. So they're really the three target audiences for this. It is a voluntary guide. There's no compulsion to it. It doesn't replace vocational education standards. It certainly provides guidance to universities around how they set their curriculum, but again, not a determinative piece. And I think the really exciting thing about the process that DTA have gone through to create these standards was extensive consultation with practitioners, academics, and others, but most importantly, people living with dementia. And that's quite a unique difference from a lot of the other standards that have been developed across the globe. So really pleased that it's had very much that clear focus. So extensive consultation resulted in identifying that there's actually 14 different domains of knowledge and skill that people need to look at developing to provide the best possible dementia care. And I think importantly, tiers of across those different domains that enable you to be clear on what's the nature of the support you provide to people living with dementia and where do you fit on that tier. So people who are providing care on a daily basis to someone will obviously need a greater level of knowledge than someone who might have more episodic contact, which might be more at that sort of tier 1 level, and grading upwards as people become more dementia practice leaders, sitting at that sort of tier 3 level with the framework. Quite detailed information about those tiers and those different domains of knowledge, as well as skills and knowledge descriptors across those different domains. So there's quite, as I'm talking, you can probably imagine there's a bit of almost a matrixy piece here to help guide those different audiences in forming either where they might identify gaps, but also strengths, as well as providers developing up their own training pieces. So, and it's for that reason that we'll talk a bit later about some work we've done to aid providers particularly, but also individuals in how they can assess where they're at against for the framework, using a helpful app for that purpose.
David, it's quite a complicated or complex scheme. People can get more information if they go to the Dementia Training Australia website.
Absolutely. There's the framework. There's some useful resources there. There's a self-planning tool that they have as well. It developed up there on the site. So certainly, and a nice video which can take you through the actual framework. So I encourage you to go there for more information.
Thanks, David. I'd like now just to turn to Megan Cox. Megan, we've seen some really significant changes changes happening in the aged care sector over this year with the introduction of the new quality standards commencing hopefully on November the 1st this year, as well as the release of the new dementia training standards. I wonder if you can speak to us a little bit about how the new standards will enhance the care of people living with dementia and how the education and training framework, the Dementia Education and Training Framework, will support organisations to meet the requirements of the new strengthened standards.
Yeah, thanks, Gary, and great to be here today. I think in relation to the new standards, a really important part of that is placing the older person at the centre of care. So if we reflect on that, I guess the strengthened standards, it really also emphasises supporting diversity of older people, and that includes people living with dementia. So that's where if we reflect on all of the different elements that come into the standards, it really is about getting to know that individual and how we can effectively support them and what's meaningful and important to them, and allowing them to make decisions and making sure that their rights as an individual are actually supported. That's where we talk about person-centered care, but really important to, if we think about person-centered care, it is about placing that individual at the centre. And that's where there needs to be that ongoing communication and support. And the strengthened standards really tries to consider each of those elements of care, but making sure that that person is part of that care process throughout. It also comes back to how providers consider to support this on a day-to-day basis, and looking at what putting that person at the centre of care actually means, so that staff actually have a really good understanding of what person-centred care is, and recognising that what does that actually look like. So I guess with the standards, they have really tried to make them more measurable. They're a lot more detailed, and they also really reflect what good care looks like. So from a provider, that is also then thinking about what that actually means for that individual that you're supporting. And in relation to the education and training framework, it really is a great opportunity as it supports a pathway to better support people living with dementia. It also is going to enable that consistency and understanding of dementia care, but also making sure that staff have that practical knowledge and skills to be able to provide that comprehensive and meaningful approach to their care. And I think what is also important is that when we look at the education and training, it's not just about the training and education itself. It's also about seeing how that's being implemented on a day-to-day basis, and it's having that positive outcome for people living with dementia.
Thanks, Megan. I have a supplementary question, if that's okay.
Of course.
How will organisations, aged care providers, be able to use, I suppose, the education and training framework to support their meeting the accreditation standards, the strengthened accreditation standards?
So I guess that's where they need to consider what is expected with those new standards. Training and education is a really important component of that, absolutely. But it's also about making sure that that training and education is what's going to drive and support that quality care service and service provision, so that staff are actually able to meet that individual's needs, and that practice also aligns with best practice and it really considers the person that they're supporting, but it also enables that opportunity to look at training and education at that organisational level, but also considering individual staff knowledge and capability as well, so that they can make sure that I guess we have a range of different workers in an aged care setting, making sure that everyone's equipped with the right skills, but also that ongoing supervision and mentoring as well.
So so accreditors will be looking for evidence that facilities and aged care providers are tapping into the training framework?
So this is where providers need to absolutely have their systems and processes in place of what training and education they're currently delivering their staff, and making sure that that is also meeting the needs of what I guess that dementia training looks like, and that's aligning with expected practice. So using these different really valuable sources of training and education and guidance is going to be one of those really key tools to help support providers to also recognising what those learning needs are, but also making sure that their staff are equipped with the right knowledge and skills in those areas too.
Great, thanks, Megan. I'd like to throw now to Jackie. Jackie works as a facility manager for St Vincent's Care, and I suppose in some ways we're bringing it right down to the ground level. I'm just wondering, Jackie, if you could share with us how you see the new dementia training and education framework will support your organisation to improve the lives of people living with dementia, but also to meet those all-important accreditation standards.
Yeah, definitely. Thanks, Gary. So as an aged care facility manager, I see the framework as being really valuable to support both the staff as well as the individuals we're caring for. One of the biggest strengths of the framework would help to deepen our understanding of the individual needs of people living with dementia, particularly around how to promote inclusivity, coordinate support, and how we empower individuals living with dementia to live a life promoting their basic human rights, essentially. Um, it's really easy to fall into a routine in aged care, but dementia care requires something extra. It requires staff and representatives to be equipped with knowledge of the disease, to have patience and empathy and a real commitment to person-centred care. And I see the framework as assisting us with strategies to be able to apply that every day. It will help the staff to feel more confident, in particular, to equip them to be able to respond to the unique challenges that dementia can bring, while also recognising, of course, the person behind that diagnosis. It also helps us to respond and to support representatives. They are often faced with challenges as well of accepting loved ones' preferences, and it's important that we're able to provide our staff with that confidence to be able to reassure and support representatives through mitigating risks and promoting residents' choice. In aged care, that's always a big one. From a leadership perspective, it's a very needed guide, a very overdue guide, I think, to what training and education might be beneficial and required within our team. It aligns really closely with the expectations of the standards around consumer dignity and choice and the delivery of personalised care, with particular emphasis on individuals living with dementia being supported to take meaningful risks, an area that essentially industry-wide training is more required, to give staff the confidence to approach those meaningful risks. Most importantly, I suppose at the end of the day, it's about the resident and feeling more understood and supported through their choices that they want to make. It will give us the ability to make staff feel more capable and connected to their work, create a stronger culture of compassion and respect. At the end of the day, it aligns so closely with the new standards. It will provide us evidence to give to the Commission as well that we are meeting those standards and that we are making intentional, driven progress towards providing the best care for residents.
Thanks for that response, Jackie. And I'm going to throw another question at you. I know this is unscripted. One of the things I really liked when I had a look at the education and training framework was the idea of tiers. So for each of the major domains, there are 3 or 4, I can't remember now, tiers. And to me, that suggests that everybody working within aged care, regardless of their role, has a role in supporting people living with dementia. And we're talking about the maintenance people, the reception staff, hospitality staff, as well as direct care providers, registered nurses, visiting GPs or whoever else may be involved. I wonder if you've got any comments about how the framework provides you with a way of upskilling all of your staff, I suppose.
Yeah, absolutely, Gary. So that's 100% correct. Everybody, the whole home, every single role needs to understand dementia more and how to support residents. I touched on taking risks earlier, and I suppose the best example that I can think of for that is we all know that people living with dementia often gravitate towards front doors of facilities and things like that. They all want to go for a nice walk down the street. And historically in aged care, we've been taught that we need to keep that person safe. We need to keep them within the home. But it's so important to be able to educate the rest of the staff, such as the administration team or anyone that's walking past that resident, to be able to go, well, hang on a second, why can't that resident go for a walk? Maybe I should give the RN a call and just let them know that can I ask them, can I take this resident out for a walk? Because really they just want to duck down to the post office or walk up to the corner. They want to pick some flowers. So it's really important to promote that decision making within the team as well, and give them the whole team the confidence to be able to go, well, that is a basic human right as well, to leave the home and go and get some fresh air. And if people living with dementia should be granted with that same opportunity.
Excellent. Thanks, Jackie, for that
No
response.
problem.
Now, we were going to go to questions from the audience. Vicky, do we have any questions?
Yes, Gary, we have a couple. One I'm going to throw to you now. Are there self-assessment tools available for providers to assess their standing under each domain?
What a very good question. Almost scripted, one would have thought. Thanks, Vicky. Yes, and we will talk a little bit about a couple of tools that are available towards the end of the webinar. Certainly at Dementia Australia, we have produced an assessment tool that will be freely available, but I'm not going to say any more about that because I'll hand over to one of our speakers a little bit later to talk us through that. Vicky, were there any other questions?
Yes, there are other questions. Let me find you one. 1 second. Sorry, bear with me. Find one that's really popular. Okay, I've got, will the framework be assessed during a compliance review alongside of the strengthened ACQSC standards?
Thank you for that, Vicky. And I might throw that to Megan. Do you have any comments on that question, Megan?
Yeah, no worries. So if we reflect on the strengthened standards, I guess there's various components that relates to the specific training. So what the Commission and our role as a regulator is making sure that the provider has maintained and implemented an appropriate training system. And that's where the education and training framework can be a really valuable resource to make sure that training is actually fit for purpose, meeting the skills and needs or knowledge needs of staff at the service, but also that they're also able to deliver that quality care for people living with dementia. And I think that's where it's also really important to remember that it's absolutely about those systems and processes for training and education needs, but it's also about how do you monitor the outcomes and the effectiveness of that training. And that's where this framework provides that consistent and comprehensive guide about what that can look like and support that pathway, so that the dementia training component is actually aligning with best practice, but also it also does really support that person-centered lens and looking at each of those really important care elements as well.
Thanks, Megan. It seems that question around the use of the education and training framework, dementia education and training framework, and how they, I suppose, dovetail into the new strengthened standards is one of the questions that has popped up in the questions a little bit. I might actually throw to David and then to Jackie, if that's possible. David, could you tell us a little bit about how, during the development of the framework, the education and training framework, what the thoughts were around how they would fit with that accreditation requirement that all providers have?
Yes, look, I think the first thing to point out is the standards were developed with the intention that they're sitting not in any one sector.
Yep.
That dementia is something that confronts our entire community, sadly, and affects a whole range of workforces. Some in the care space, some in the broader community, retail, whatever, first responders, a range of different contexts. So the standards have been developed up, and you mentioned the tiers before, with the clear intent that this is a community-wide responsibility, and the guidance provided in the standards enables people to determine where on the standards the level of dementia knowledge and skill they need to be making sure that they attain. So I think it's fair to say that, yes, certainly there is an eye on the standards in aged care, probably eye on standards in other contexts, disability and others, but a recognition not to wed them to those, because the recognition, of course, is those standards do periodically go through updates and improvements, as they rightly should. So important to recognise that these are a standalone piece of standards that are intended to inform, influence, and contribute to all of those sectors and others that are not in direct care space as well, so that we're trying to lift the entire community in line with the National Dementia Action Plan that was released late last year, and recognising that we've got to, if we're going to address the impact this has on our community and the services that are there to support them, we need to have a clear roadmap for that. This framework provides that roadmap, provides that clarity. As Jackie mentioned before, it's probably long overdue that we needed this kind of detail and provide a real sense of direction, I think, for providers identifying what their staff needs are, and individuals as well, so that there can be a greater clarity on where they're at and where they need to get to, so that there is that clearer pathway for how they actually build their dementia capability, which we've talked about with providers for some time, is how are they building that capacity. As you know, we get a lot of requests for that sort of foundational training of workforces, but and we're seeing changes in that now, but for some time, providers would not get beyond that. They come back to us in another 12 months and say, can you give us that base training again? Sometimes reflective of turnover in the workforce, of course, which we know is an issue, but it did mean that we weren't actually getting that progression and that enhancement of capability, and therefore the further improvements in dementia care that Megan's flagged in her comments that we need to see. And so I think this provides that clear guidance and direction to help providers in that sort of workforce planning, workforce mapping, an area that we know, certainly we know providers have struggled with at times because of just trying to fill shifts and make sure they've got staff on the floor. So this is a reach piece for providers in that respect for some of them, but I think it puts a stake in the ground in terms of what providers should be aiming for, should be seeking. And hopefully with that also we'll get something that helps with some of that retention issue in the workforce as well. Because if people are feeling that they have the necessary skills and knowledge to perform their job, hopefully they're getting much more satisfaction and more rewarding work experience and more likely to stay in the sector and do some incredibly valuable work, enjoyable work, yes, challenging work at times, but also when you see, I think, the care delivered well, it's also a great opportunity to be really creative. And you can really mix it up, I think, when you're really seeing how you can best support someone, because we know, what happened, how someone reacts to something today or responds to something today might differ tomorrow, might differ this afternoon. So you've always got to be, from a basis of understanding the person and who they are and knowing that person, really mixing it up to going, okay, what else can I try? What else I don't need to think about? Drawing on this knowledge, drawing on this skill, identifying areas that you might need further skill enhancement. The other final point I'll mention is we know that probably 90% of learning happens on the job. So whilst some of those training pieces are certainly some really key foundational elements, it's what providers are doing to have dementia practice leaders. And this framework really clearly identifies what those practice leaders need to have to really role model, to coach, to mentor their colleagues, their peers, their staff in how to best apply the learnings from that education to their practice. And that's where you'll see the real game change, I think, in terms of the quality of care delivered out there.
Thanks, David. I think some really important points. That the idea that the dementia education and training framework is not another regulatory millstone. It's a development tool, a way that organisations and individuals, I have to say, can look at their own dementia knowledge, their skills in dementia support, and think about how they can develop beyond, as you were saying, that foundational level of knowledge. Jackie, have you got any comments about how that would look on the ground? And also, and again, I'm going to throw this one in, sorry for doing this, the idea sort of that implicit in what David was saying, that the education and training framework is perhaps for the first time in Australia really providing opportunities for what I might call career progression within dementia. So we might have people operating at that foundational level, a bit of knowledge about the disease processes involved in dementia, some other skills in communication. But following the framework, the education framework, people will be able to deepen their knowledge and their skills in that area. And maybe we will actually see a career pathway for people specialising in dementia.
Yeah, absolutely. So to touch on the assessors and coming in, because I know that's hot on the questions at the moment. I think at the end of the day, the framework shows a proactive approach to learning for a home. So if the assessors are coming in, they want to see that you've got things in place, that you've anticipated challenges of the people that you have within your home living with dementia, and that you've equipped the staff to be able to support those people within the home. So that to me is a green flag when the Commission walk in, that you've got a continuous improvement plan in place to be able to evidence that you have additional training and everything in place to be able to support residents living with dementia. It's responsive, it's thoughtful, it's everything that aligns with the new standards as well. So yeah, to me, I think that it's incredibly beneficial to the accreditation process. I suppose you might have to repeat your question, Gary.
It was a long question. I
second one. It
apologise.
was a long question. I'm so sorry.
I think it's around that idea of a career in dementia support, and that we can progress within our levels of responsibility as well as our levels of skill and knowledge. That the framework actually really for the first time provides that idea of deepening our knowledge over time and our skills.
It does, definitely, and I think it gives staff the opportunity, or any individual really, the opportunity. It's just a starting point, really. So once they get involved in the framework and understand a little bit more about dementia, I think it will ignite a lot of passion within people to proceed further with other training or career development, definitely.
Great, thanks, Jackie.
No problem.
Now, one of the earlier questions was about how do we assess ourselves within the framework, and how do organisations or providers um, assess their capability around the new education and training frameworks. And I'd like to bring into the discussion now Mandy Ha. Mandy, as I said before, is trained as a physiotherapist, but she's worked for many years as a learning designer at the Centre for Dementia Learning. And Mandy's been working extremely hard, I know, over the last many months in the development of one particular tool to assist both individuals and organisations to assess themselves against the new training and education framework. So I'll just hand over to you, Mandy. If you could tell us a little bit about the new tool and how people can get access to it.
Lovely. Yep. Thanks, Gary. So Tell Tina is a new feature that's actually being released on the 1st of July, which is actually a week exactly from today. And the tool itself is, has been considered to in terms of how to make it as seamless as possible to access for people, which is why it's been integrated into the existing Ask Annie platform. But rather than me telling you about the tool, I would like to introduce you to Tina, who is our avatar, and she can in fact talk you through the tool herself. Okay, I'll just...
Hello and welcome. I'm Tina, and I'm here to introduce you to Tell Tina, our new dementia-specific training needs analysis tool. Developed by Dementia Australia, this tool is designed to support organisations to better understand the strengths and capabilities of their dementia care workforce. Mapped to the recently released National Dementia Education and Training Standards Framework, it can help your organisation build a comprehensive dementia care training strategy. And, with strengthened aged care quality standards placing greater focus on dementia, providers need more than training. They need clarity, direction, and evidence of outcomes. That's where Tell Tina comes in. Tell Tina will give your organisation the evidence it needs to demonstrate real commitment to dementia-specific education. Tell Tina delivers clear data on staff training and education needs, turning insight into action. It helps meet compliance requirements with confidence. With Tell Tina, you're not just meeting the standards, we'll help you exceed them. So now let's take a look at how Tell Tina works. Organisations can arrange access to preview the app. Once downloaded, participants can select the preview button to begin. A few quick loading screens will appear as the app gets things ready. It won't take long. After this, participants will be prompted to select their role and share a bit about their experience and confidence in supporting people living with dementia. Then they'll be asked to answer questions that explore their dementia knowledge to discover where their skills can be improved. Each question has a video and a statement that comes with it.
Living with dementia, it is best to avoid me when I am agitated.
Participants will be asked to select the answer that best reflects their understanding. One of the big benefits is being able to see results in real time, across different organisational sites or down to how each individual is tracking. The Training Recommendations Report gives a simple snapshot of each team member's training progress, their attitude to dementia care, and how they're going across different care domains. You can also filter the data by different categories, such as site, care domain, and role, making it easier to identify trends and target training where it's needed most. What sets Teltina apart from anything else on the market is simple. We'll help you identify knowledge and skills gaps in dementia care, so your teams can stay focused on delivering quality support. To find out more, get in touch with one of our business solutions specialists. Let's move forward together.
That looks great, Mandy.
As I said, the app will be released on the 1st of July, so next week. And if you want to find out more, there is the QR code on screen and that'll take you to Dementia Australia's Teltina webpage.
Excellent. Thank you, Mandy. Mandy, I understand that the tool is available or useful both for an organisational-wide snapshot, if you like, but also for individual staff to check their own dementia knowledge and skill.
So whilst the app is accessible to individuals, it will be through a campaign that will be run by organisations. So organisations need to subscribe, and it's usually best done through upgrading their existing subscription to Ask Annie. And I did actually forget to mention, sorry, earlier that the thing that's quite unique about our tool is the fact that it's been developed and informed on the basis of validated tools, so the Dementia Knowledge Assessment Scale and also the Dementia Attitudinal Scale. And using those tools, the statements within the Ask Annie tool itself uses those validated tools to springboard from.
Great, Mandy. And I have to say, as well as being extremely comprehensive, that the tool looks fun to use.
It is. It's been designed with the view that we don't want people to just feel like they're going through just a series of questions. So there are all the animated videos to go with that to help you enjoy the experience, for want of a better word.
Nothing wrong with that. Thanks, Mandy. Vicky, I wonder if there are any other questions that we could ask our panelists.
Hello. Yes, I do have a question here.
Thank you.
As a home care package provider with support workers working in the community and geographically dispersed, has training for non-residential providers been considered?
Thank you for passing that question on, Vicky. David, I might throw that question to you if I could.
Yeah, absolutely. And a really good question. I think firstly, I'd say obviously the standards themselves have been developed, as I was saying before, to be certainly non-context specific, but certainly considerate of the diverse contexts in which care is provided. So absolutely, community and the support of people in the community is a key part of that. And obviously that's where the vast majority of people living with dementia obviously live. Although that obviously recognising that in resi care, there are a high percentage of people living in that context as well. In terms of the tool itself, it lends itself really well to that environment because it's accessible through the app, the Ask Annie app. So, which of course, if you're not familiar with that, I encourage you to go and download that through the App Store, and was originally developed, in fact, for the home care workforce. And there's a whole range of useful modules that people can dip into particularly recognising that for the home care workforce, there's added challenges to getting to either online or face-to-face training. So being able to access that in the palm of your hand was something that we developed up in collaboration with some care providers in the home care environment. And certainly the key aspect of that is, you're about to walk into someone's home and you've got some key questions, very much learner driven. So it's what you need to know rather than trying to take you through a more linear piece around dementia education. So that's there as a valuable resource anyway. The added value is we're now obviously Tina's on that same platform. So you'll be able to utilise that same platform, not just for the education of your staff as a key component, not saying the app's the only thing you do, but it's certainly a key piece, to be able to assess what their current skill set is, what their strengths are, where the gaps might be, and that can inform your own workforce planning, training planning piece in the equal way that we've talked about it in other contexts. So yeah, it has broader application.
Thanks, David. You've talked a little bit about, so obviously residential aged care. You've talked now a little bit about community care or home-based care, and you also mentioned disability, the disability sector as well. The one sector we haven't mentioned, or one of the sectors we haven't mentioned, is acute care. Do you have any comments about the application of the framework within that particular huge area of support?
Yeah, look, the same piece applies, given it's agnostic in terms of not being a sector-specific framework. So has equal application in that acute, subacute, post-acute, primary health context. And again, I take you back to those tiers that determines what level of knowledge you should reasonably expect of your staff or yourself in those environments, because it will vary. If you're working in an emergency department, you're going to have fairly short, sharp interactions with people. That's going to mean you're going to need to know probably some fairly fundamental pieces around dementia, but you're not going to be in a position where you're providing daily care and support, which would probably push you up that tier much more to probably around a tier 2 or 3. So I think this is that's the real value in the way in which the whole framework has been constructed, and recognising that across all of those 14 domains, there's different levels of skill and knowledge that should be reasonably expected of staff in different contexts based on the level of contact and knowledge and involvement they have with someone living with dementia.
Thanks for clarifying that, David. And I think that's a really important point, that it's sector agnostic, I think was the phrase you used, that really anybody who's providing support for people living with dementia will find something of value and useful within the framework. Okay. Just one last question, and I'll ask first this question of Megan, but then I'll get David and Jackie to respond as well. Big changes in the aged care sector happening with the release of the new strengthened standards and the now release of the training framework. I'm just wondering if Megan, first, you have, I suppose, one action point, one call to action that you would like to share with our audience today?
Yes, one action. So I think sometimes it's really easy to complicate things or overthink what we're doing. And I think there's been an absolute great conversation today around reflecting on training and how to make sure staff have the skills they need to support. And I've talked about how the strengthened standards really emphasises putting the older person at the centre of care. So I think it's really important that we focus on this and reflect on how can we effectively support that older person and make sure that their rights are supported, their choices are supported, and what that person-centred care actually looks like for them. And I think that's where, as a provider, it's good to think beyond a I guess there's a lot of standards, there's a lot of requirements, there's a lot of information out there that you do need to meet, and that is expected practice, absolutely. And that still plays a really important role. But it's also about thinking about how can we use these requirements and these tools and these frameworks to support better care and better meet the person living with dementia, that their needs and what's important for them. So I think it's using all these really valuable sources and requirements that do drive good care to see how you can actually implement that improved practice for the older person.
Excellent. Thanks, Megan. Jackie, have you got any comments about the call to action? I think the marketing people call it. What's the most important thing that perhaps your organisation, St Vincent's Care, is doing, and perhaps other organisations should be considering?
For me, it's really simple. Just embrace it. embrace
Yep.
the framework, embrace the new standards. At the end of the day, they're all there to enhance our understanding and promote a more dignified, person-centered life for people living with dementia. And I think that's as simply as it needs to be.
I love a simple answer. That's lovely, Jackie. And look, having a look at the standards, one of the things I was struck by was to see in one place, the framework, sorry, the training framework, to see in one place the depth and the scope of dementia knowledge and skills laid out before you. So, where do I need to start if I'm just moving into this area of supporting people living with dementia? If I'm an experienced healthcare practitioner, but this is becoming something that is occupying more of my attention, where can I go? What more can I learn? What more can I do? And I was extremely impressed, I have to say, when I had the opportunity to look over the framework and just see how comprehensive it really was. David, have you got any comments?
Yeah, I'm going to be cheeky and put in a couple of points. I know you asked for one, but I think my first thing is we see a bit of a spectrum. We either have providers doing very minimal or no workforce planning, or picking up Megan's point, sometimes they're kind of in the paralysis of analysis, as I call it, where they're so caught up in the standards and a whole range of other things that they're trying to make sure they do the right thing but in doing that, it creates sometimes some inertia in actually going, well, what are we going to do? Which is, I think, the value of this tool, that it really helps them in a time-saving way, because it is all time. And that's time so many providers don't have in a variety of contexts to actually do that important workforce analysis and checking in. And we see that even with our delivery education, that sometimes we'll go and deliver a session and staff say, well, we don't need this, we need X. And that's sometimes not, that's just because their manager isn't necessarily across what are the specific gaps that the coalface where they do need that more targeted piece of education. So that's probably the first thing I'd say, is have a plan. Because if you haven't got a plan, you're not going to know if you get there or when you get there or how you get there. So that's the really critical thing, and I think this tool certainly helps with that. The second point that I'm going to squeeze in cheekily is about really look to how are you going to build the dementia practice leaders in your workforce? Who are the go-to people? Who are the ones that you want to be championing good practice, who are good at role modeling, who are good at coaching their colleagues or others in good practice? Because they're the ones that are going to be the game changer for you. They're the ones that are going to enable education to stick and to be applied in practice. So any of the resourcing you're putting into education, we know it's a huge cost to actually take staff out of the field, or if they're going to face-to-face education, or even to do online, even to use an app. So you want to make sure that's going to be a multiplier effect when it comes back into the workplace. That's where having those dementia practice leaders is a really key point, And we've talked before about creating career pathways. That's something for your workers to aspire to, and that they can see that there actually is some rewards in a career sense to working in dementia care.
Yep, I think we can only agree, David. Any final points that I've noticed we've just got a few more minutes left. Megan, you look
Can I
like you.
be a bit cheeky,
Please,
Gary, and I might jump in
please
there
do.
based on what David also said, because I think it's just a good opportunity to think about those training and frameworks that you are implementing as a service and making sure that they are fit for purpose. But an important part of that as well is looking, because I guess if we think about the commission and when we're coming out and looking at the training that's being delivered and that the staff actually have the skills they need to perform their role. Part of that is, if we kind of just think about it as a simple sort of example, is for if you identify that staff need more training about behaviour support planning or dementia care, sometimes the information that we receive is that you've delivered a session about behaviour support plans, but it's more, yes, that's an important component, but it's also looking at what is the outcomes from that training? Do staff actually have a good understanding? Are they implementing it on a day-to-day basis? And that's where these frameworks, what we've that have been shared today, can also provide a bit of that guidance about that consistent dementia care practice, what that actually looks like and aligns with best practice principles. And that can support providers to reflect on, is your training actually meeting those needs? Do the staff actually have a really good understanding? And then also looking at, is it actually happening on a day-to-day basis? Because training is really important, but it's also that supervision, mentoring and support that happens every day to make sure that we're getting those meaningful outcomes for people living with dementia and really driving that improved practice every day.
Thanks, Megan. I think that's a really important point.
Can I just add to that, Gary? Because I think
you can, David.
I think that's a really interesting one, because I know we do a follow-up piece about 3 months after we've delivered any kind of education to a provider, and it's interesting having those conversations with managers, which I think reflects some of the points you've made there, Megan, about what are they doing post the education to ensure that that application and see where it's landed, where it hasn't, is there pushback? Because sometimes there's also some unlearning that needs to happen, which can be really hard when you've done something a particular way and you're having to relearn it a different way. And that requires a level of support at the workplace that is not always easily identified. And I think sometimes managers have an unrealistic expectation that the education piece is the magic bullet. It's not. It's a key piece of it. But if you think having an education session is what's going to shift the dial, you're certainly misguided in that thinking from what the research tells us. And that's why I was saying before, and I think you've emphasised it well in your comments just then, Megan, is how are you tracking, how are you assessing, what are those staff that you're relying on to ensure that those learnings are being applied in an ongoing continuous improvement way. This never stops. It's always, oh, okay, so they've got that bit, they don't seem to have grasped that bit. How do we support them in doing that? As well as reinforcing the things they are doing well. We know that so many staff in certainly aged care are always afraid of doing the wrong thing. And how we can give them the confidence and competence to be able to know, no, I'm doing well.
Yeah.
And that ties into the broader workforce challenges we've talked about, that if they are feeling confident and competent in how they best provide support to someone living with dementia, they're more likely to be satisfied in the work they do, they're more likely to find it rewarding, and we're more likely to retain them, which is such a critical thing, obviously, in terms of continuity of care, if we're going back to the person-centred piece.
Thank you, David. That's an excellent summary, I think, of our brief discussion today. I know we've got 1 minute to go, so I'd just really like to thank you, David, Megan, and Jackie for coming along. I know you're all very busy people, but we've really appreciated the insights that you've been able to provide today. They are big changes happening within the aged care sector. They're not just superficial changes. They're quite fundamental changes in some ways. So it's been really valuable to have your expertise and your insights. Can I also thank the team behind the screens, Jackie, Jim, Taylor, all the people who are crucial to the broadcast going ahead or the webinar going ahead. Thank you all very much. Just to remind all of our viewers, the webinar has been recorded, and within the next week or so, we'll be able to send you out a link to the recording of the webinar, and you can also on the same YouTube page, have a look at some of the previous webinars as well. So thank you everybody for spending some time with us. We look forward to catching up again in a couple of months, where we'll have another hopefully insightful and interesting discussion. Thank you all.